I talk quite a bit about the pandemic and how so many Americans have lost trust in science and in our public health professionals. Some of that warranted, some not so much. And in some ways, it is costing lives because we are now seeing a decline in the life expectancy in our country. And some of that, I think, is due to the fact that our healthcare industry may be very good at treating disease. If we don't trust our doctors, we likely won't take part in preventative medicine. Like I've said, you can't trust your doctor. Who the hell are you going to trust? Let's talk about that specifically in the greater issue of trust and information in science and medicine as we bring in Dr. Geeta Nayyar, a physician, rheumatologist, expert in autoimmune disease here in South Florida, former chief medical officer for Salesforce and AT&T. Her best-selling book is titled Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. And you can follow her on X at DRG Nayyar. That's Nayyar. Dr. Nayyar, good to talk to you again. I appreciate the time.
Thanks so much for having me, Manny.
I want to get to the book and everything that has changed because of the pandemic and everything in a moment. But we do have a problem in this country in terms of not only our health care, but especially guys. Men generally don't like going to the doctor, even just to get something as simple as yearly checkups. And that likely is part of what's behind this decline in life expectancy, no?
Well, you know, it is always the woman of the household making the appointment for the men of the household.
That's right.
So whether it's right, your wife included, my husband included. So whether it's the sister, the mother, the daughter, the granddaughter, it is true that women remain the caretaker of the household, whatever that household looks like.
The book, it isn't a COVID book or a book about the pandemic, right? But you kind of use that, it seems, as the jumping off point to examine what people believe and what contributed to illness and death during the pandemic, right?
You know, the book is really a post-pandemic review of the digital age of mis and disinformation. When we talk about AI, we talk about TikTok, all the new technologies we have to communicate. We have to recognize that this technology can be used to communicate good facts or bad facts. And so it's really meant to call out that this has been a chronic issue since the beginning of time in healthcare. But the bad news is traveling 6 times faster. Misinformation travels 6 times faster on a lot of these apertures. And we have to do better. Healthcare has to do better, and the consumer has to do better.
And you talk about the difference between information, misinformation, and then there's also disinformation.
That is correct. So misinformation is just, you know, you got it wrong. The facts weren't right. They just weren't right at the time when they came out. And disinformation perhaps is more dangerous because this is the intentional manipulation of the masses to profit, whether financially profit, politically profit, whatever the profit might be. It is actually meant to dupe the receiver of that information.
Something else you talk about is that when we go through these periods, like during the pandemic and since then, it also brings up all sorts of mistakes or misdeeds that we've seen our country do in the past, and that also gives people some pause to whether they can trust or believe in science.
Well, I would tell you that this is a global issue, Manny. First, I'm so thrilled you read the book. Thank you for that. But I am tickled to actually see this conversation actually happen at a global level. So it is actually not a domestic issue, but in fact, science is complicated and we get it wrong often. And somebody's selling a supplement for the low price of $29.99 when science... Right? When science misses the mark, there are people out there willing to buy that vitamin. And when you can't get a doctor's appointment, well, there's this shaman on TikTok and he's got cool dance moves. I'm going to listen to him. Right?
Yeah.
So that's the myth. It's how do we make science cool again? How do we get science to have a PR campaign? And how do we just make it much more reachable, relatable, and accessible for the everyday person?
And that brings me to this. One of the tenets, I think, of science, and I'm not a scientist, you are, I've just been interested in it since I was a kid. You have evidence or a hypothesis, you test it, you come to a conclusion, right? Sometimes, often, science changes when you get more information about something. And I think, and I've talked about this before on the program, people like Dr. Fauci seemed too often during the pandemic to be absolutists rather than leaving the possibility that what was believed at that moment could and likely might change. And I think things like that made many Americans begin to question everything that they were told about COVID and vaccines and everything else.
So again, we lived through an unprecedented time, right? And we really were literally driving the car as we built it. And there's no doubt that mistakes happened. But one of the things I think was lost in translation is that science takes time. To get evidence-based medicine takes time.
Mm-hmm.
And, I like to bake. I have a 11-year-old at home, and we like to bake. And sometimes you're so sure of what you're making because every other time it works.
Right.
And you test the salt, you test the sugar, and all of a sudden you got to change. You got to change directions. And so I think the world really saw population health and evidence-based medicine happening live, and it's not pretty. It can be sloppy. And so there were ample opportunities to have improve the communication, improve the medical decisions folks were making. But again, we lived through an unprecedented time. And the question now is really, what do we do about it? How do we do it better? How do we ensure people know fact from fiction? And how do we also ensure the masses and the population at large never get confused about the difference between a bacteria and the virus?
Yeah.
Right? Any virus and any bacteria, you got to have basic health literacy. And so I think that's one of the things I learned as a physician is to say, gosh, we just got to elevate the science conversation. No one can confuse you when you know the facts.
Yeah.
When you know basic information.
Yeah, and there's no such thing as alternative facts, right? Facts are right. The problem is too often these days over the last few years, we can't agree on what those facts are. And I also think, Dr. Nayyar, it's fair to say there were some positives that came out of the pandemic, right? We've learned a lot, especially from our failures. What do you think was the worst thing to come from the pandemic in your view?
Well, look, I think more than ever, we have realized that healthcare and science is actually a communications business. People have questions and they're looking for an expert to answer them, just like your lawyer, just like your accountant, just like any other services business. So the biggest thing I think we learned is in the absence of science, grabbing the dialogue, owning the narrative, scaling the patient-physician relationship, there will be misfits that fill that gap.
Yeah.
So if we, in fact, do not have doctors on TikTok, if we do not have hospital systems owning the narrative, the way I talk about Cleveland Clinic in my book, they scale that conversation. They said, look, here's the facts. This is what you should know about science. And then come make an appointment. Come see us if you have a question. And that's really what's missing in healthcare today. We've got to use the technologies that are out there, virtual visits, to social media, to AI, to own the conversation and not let the misfits out there with the disinformation train take our patients down the wrong path.
Obviously, we could have you on for hours to discuss some of these issues. How do we build that trust, that faith in science and in our public health experts again? Or for some people in our country, are we beyond the point of rescue, do you think?
We are never beyond the point of rescue. I am a forever
You're an optimist.
Always. Well, number one, I think people like you, I think celebrities out there, people with big mouthpieces, having the conversation, putting it out there, I think that's important. We need to, as consumers, be smart, look at our resources, look at where they're cited, validate the science. We need to make sure we have a relationship with a doctor before we're ever sick and before we go to an urgent care or ER. You want to have a doc that knows you, your personalized history. And as a healthcare industry, we got to do better. So whether you're a hospital system, an insurance company, a life sciences company, making this a strategic priority to say, how do we own the patient-physician relationship and put the technology squarely in scaling that communication? That is the first part before anyone does come to the doctor. They got to know who they are, feel like they know, like, and trust them, and then come in and get their healthcare services. Yeah,
I got to tell you, it was life-changing for me when I found the doctor that I have now, a primary care physician, who I felt comfortable with, to have that cut, to be honest, because sometimes people go to the doctor too, and they're just not honest. They don't tell them what they're feeling or how they're not feeling well. People need to know their bodies. And what's the point of going to the doctor again? As I said, if you can't trust your doctor, who are you going to trust?
That's right. I'm going to leave you with two stats, Manny. One, 57% of Americans still trust their doctor more than anyone else. And number two, 59 million Americans look to social media influencers for their healthcare information. We need to combine those. We need to have more healthcare leaders out there with microphones, not being the marketers, working with the marketers, science, marketing, communications, PR. They got to work together. They haven't traditionally worked together, and that's the missing piece. We developed groundbreaking, innovative vaccines in 9 months, and then we couldn't get anyone to take them because we botched the communication. So we now got to focus on that, and that's really the public health message. Is half of public health is communication and building that science relationship long before you ever need it.
1,000%. Got to have you back soon. Talk about the problems with our healthcare industry, doctors' offices, bedside manner, and the health insurance industry, because they're such a big part of how our nation's healthcare runs. Want to talk to you about all that stuff if you come back after the beginning of the year. Deal?
Anytime. Thank you so much, Manny. Appreciate it.
Thank you. Dr. Geeta Nayyar, a physician, rheumatologist. She's an expert in autoimmune disease here in South Florida. The book is titled Dead Wrong: Diagnosing and Treating Healthcare's Misinformation Illness. I highly encourage you to check it out. Some good holiday reading as well.